Let's talk about Sculptra. Sculptra is PLLA, polyl-lactic acid. What is that? Well, PLLA has been around for years in the form of absorbable sutures. So some scientists just got really smart, realized that this PLLA created a strong fibroblast response. Fibroblasts are little cells that make collagen. Really strong fibroblast response. And these fibroblasts made a lot of type 1 collagen, type 3 collagen, and they were like, wow, why don't we grind this up, mix it with water and lidocaine, and inject it in people's faces? Let's see what happens. So it was originally studied in HIV patients. Early HIV medications cause lipodystrophy or fat atrophy, especially in faces. And so it was studied in these HIV patients who lost a lot of volume in their face from these medications, and it worked really well. So they're like, this works really well for these patients and it helped rebuild and restructure their faces. Well, everybody can benefit from this from an aesthetic reason. And there, Sculptra was born. And so we use it today now for aesthetic purposes and rejuvenation purposes. And I love it. I include it in all of my decades packages at Bijoux Med Spa because I think pretty much everybody can benefit from it, outside of certain individuals with certain autoimmune issues. But other than that, it's great for all skin types and colors. And it's not always about restructuring your face into something that it wasn't, but just maintaining the youthful structure that you had. And so it does a beautiful job at that, and it does it very naturally. So how does a Sculptra appointment go? So we have patients, we come in after a consult, a thorough consultation always. So after a consultation, we have them come in, we numb their faces. After 30 minutes of numbing, we clean everything off, squeaky clean, and then we inject Sculptra. I use personally here at Bijoux a combination of needle and cannula. So needles are sharp, cannulas are dull. There's less of a risk for bruising with cannulas because it helps push blood vessels aside where needles can pierce right through them. So when I'm working in more superficial planes, I tend to like using a cannula. Or if I'm going deep in the deep medial cheek, there's some important blood vessels there. So I'll use a cannula to inject my Sculptra in the deep medial cheek plane or along the zygomatic bone. Here, I'll use cannula. I'll use needle in areas like the temple, deep in the piriform, in the jawline area. It works really well there too. So I use a combination of both needle and cannula and try to minimize bruising in my clients. I use different dilutions of Sculptra as well. I'll use more concentrated dilutions of Sculptra when I'm injecting deep down to bone, temple area, cheeks, deep in the jawline. I'll use a more diluted concentration of Sculptra when I am trying to improve skin quality and texture, like the fine lines and wrinkles of crepiness. We're going to be injecting that more superficially, fanning it around with a cannula, versus trying to build a deeper volume. Then I'll use that more concentrated version deeper down on bone. So it is a very specialized, I think, procedure. It takes a while to really get to know Sculptra and what works for people. There is not a paint by numbers with Sculptra. Every single Sculptra patient that I do, their treatment is individualized. I am doing different concentrations on different faces, different injection points. Sometimes people's temples are fine. They don't need anything there. I'm focusing more on the mid face. So every single patient is an individual and they get customized treatments with Sculptra. So there's not one specific way to do that. And you only learn that through a lot of experience. So afterwards, post-care, you have to massage. That's the biggest thing in post-care with Sculptra. So with Sculptra, you need a massage, and this is to prevent Sculptra nodules. And this is why it's not a good idea to inject Sculptra into patients that may have inflammatory autoimmune conditions. Their fibroblasts may activate too easily in response to the Sculptra, create too much collagen. It's kind of like in the people who get keloids. They have overactive fat fibroblasts. They don't know how to shut off and to stop making collagen, and those scars keep building up. If a patient has a history of keloids, I really wouldn't be wanting to inject Sculptra in them just because of the higher risk of nodule formation due to their fibroblasts not knowing how to shut off. So you have to screen your patients correctly, but most people can benefit from it, as I said. But you want to go and you want to massage your Sculptra afterwards, because when we're injecting Sculptra, remember, it's a powder, and we're mixing it with water and lidocaine. And then after we inject it, we want that powder, that miracle grow, those PLLA particles to remain dispersed throughout our tissues evenly. If we're not massaging and we're moving about our day, talking and everything, and too much of those particles, those PLLA particles, cluster up in an area, too much collagen can form in that area, and then we can get a Sculptra nodule. There's certain areas that we wouldn't want to inject Sculptra that are no-no zones for me. I know some providers that get a little ballsy with this, and they do run into to some issues, but I do not inject Sculptra under the eyes. I do not inject Sculptra finger breadth away from the mouth. I do not do it in the nose. I do not do it directly in the chin. These are, or in the forehead. These are higher risk areas of Sculptra, and I don't want to deal with nodules. So really great for helping build that periphery or scaffolding back here. But outside of the massaging, and I recommend to do that 5 minutes, 5 times a day for 5 days. And I tell patients that because if they do that, then they're only going to do 3 minutes 3 times a day for 3 days. You cannot over massage with Sculptra. You can't. More massaging, the better, the less of the risk you're going to have for nodules. And I really beat that into my patients or my clients' head, and they see the importance of that. And so they're always really good at massaging, and I never have an issue with Sculptra nodules because of that, I think. There could be bruising. You could take some arnica prior to your appointment, some arnica after. Bromelain is great, as bromelain is good as well. I sell arnica fort tablets here at my office. It's a combination of bromelain and arnica together. It's just 2 pills a day. A lot of the arnica preparations over the counter are 5 pills a day. So it's much easier to take for patients. Have them take it 3 to 5 days before, 3 to 5 days after. It can really cut back on bruising and inflammation. After your Sculptra visit, because again, we're injecting a lot of water in your face, you will look volumized, but then it's all going to go down. You're going to absorb that water, absorb the lidocaine after a day to a few days, and you're going to be like, what the hell did I just pay for? I look the same, sans maybe a little bruise or something, but that's the beauty about Sculptra is it slowly grows over time. So you just start looking at yourself in the mirror and like, oh, I see it. And people start looking at you like, what are you doing? You look good. So that's what's great. Versus like if you get a hyaluronic acid filler, we're injecting that in your face, you leave here different that day. It's an immediate result. Sculptra is a gradual result, so it's a little bit harder for people to pinpoint what you're doing. You just start looking better. So treatment protocol, how many vials of Sculptra will you need initially? Good rule of thumb is a vial of Sculptra for every decade of life. Yes, there's some variability in that. If you are a very thin and gaunt person, you might need to round up a vial from that standard. Or if you have a more full face, you could round down. I started Sculptra in my early 30s. I started out with 3 vials, and I tell my patients you should get 1 vial a year thereafter. Once you hit your 50s and beyond, sometimes there are some years that I might recommend we do 2 vials a year for maintenance. But otherwise, I just recommend 1 vial a year for maintenance. So maintenance is pretty easy with Sculptra. And it lasts longer than filler. On average, Sculptra lasts 25 months. Again, I like the yearly maintenance, so you're not having to wait till it all wears off and then rebuilding that all back up, needing as many vials to build back up. You're just getting your 1 vial a year after your initial buildup. So I never like to inject more than 2 vials of Sculptra at a time. I think injecting more than 2 vials at a time increases your risk of nodules. So I only inject 2 at a time. So let's say you're 50 years old and we prescribe 5 vials of Sculptra to you. You'll get 2 in your first treatment, wait 4 to 6 weeks. You'll get another 2 in your second treatment, wait 4 to 6 weeks. And then we'll do your final vial in your third treatment. So we space treatments 4 to 6 weeks apart. You can space them further out. You can space them 12 weeks apart. It's just going to take you that much longer to see your final results. So 1 to 2 vials of treatment. Treatments are 4 to 6 weeks apart. Final results are typically seen 8 to 12 weeks after your last treatment. So it's a gradual buildup, which a lot of people like because people can't place their finger on what you're doing different. Very natural looking results, can help with everything from skin texture to volume correction. Skin, people say you have a Sculptra glow. So you get this glow from Sculptra. And again, that goes along with the skin texture, almost like a brightening glow as well. So there's lots of benefits to Sculptra. Now, there's been some controversy in the past with Sculptra, and you have some big plastic surgeons that are on social media, poo-pooing it, saying it inhibits you from getting a facelift later down the road, or it makes facelifts harder because it makes the tissues too sticky. So when you have a lot of collagen within your tissue, there is some rule or some training, a thought that it can make the tissue a little bit harder to dissect because there's more collagen fibers connecting it. Here's my issue with that is if you're getting a facelift, hopefully you're going to somebody who's really good. And facelifts nowadays are costing 100K plus. So boo-hoo, you have to take 30 more minutes on your dissection, to do a facelift. But most plastic surgeons that I speak to, and I have a plastic surgeon as my medical director here at Bijoux, they don't see much of a difference. If you're going to the right injector and they're injecting Sculptra in the right plane and in the right concentration, you're not having a lot of issues when you're doing facelifts. There are many plastic surgeons that offer Sculptra as a treatment within their practice. So I think a lot of it's for clickbait. They're just wanting to get more publicity and coverage, and they want to cut. They want to operate, and they want their job to be as easy as possible. So I don't feel bad for you when you're making 100 to 200K a facelift. So quit crying about it. I do tell my patients, if you are considering a facelift, and I plan on getting a facelift. I'm trying to hold that off. It's my last year in my 30s. I'm trying to hold that off till mid 50s. But I do Sculptra. I've been doing Sculptra since my early 30s. If I thought Sculptra was going to prevent me from getting a facelift in my 50s, you better believe I wouldn't be doing it. But I think it's a bunch of crap. So I do tell my patients, if you're considering getting a facelift, let's switch over to filler for 2 to 3 years prior. So don't get Sculptra for 2 to 3 years prior to getting a facelift. Let's just say if your tissues, if you do have a lot of collagen and collagen fibers in there from the Sculptra, they're going to be pretty broken down by that point, and it'll make their jobs easier. Not that most surgeons say it's harder anyways. So just don't do Sculptra 2 to 3 years prior to a facelift, and you should be a-okay, and nobody should be crying about it. Okay. So to wrap it up, I love Sculptra. It's an incredible biostimulator.